For people that are considering joining the nursing profession, I think there's honestly never been a more exciting time for primary care. We want to be in prevention mode, we want to be ahead of the disease instead of trying to cure it. We want to be preventing eye disease instead of fixing it, foot disease, etc. We want to be preventing people having to go to the hospital and having blood glucose levels that are out of control. So by monitoring blood work without symptoms, we can often find patients that are at risk and be ahead, proactively managing their diabetes. There's lots of technology coming into this arena. We can do remote monitoring. There's all kinds of technological advances now coming into for patients to help self-care, apps and things like that. So I think as a nursing professional, it's a great time to be a coach to these patients. We've got social prescribers now and people that can help manage people with diabetes effectively. So some top tips then on World Diabetes Day is we want to be in prevention mode. There's so many things people can do to keep themselves healthy. I know we've got run, talk, run, park, run, exercising on a regular basis, taking care of your weight, going for regular screenings, watching your blood pressure. It's never really been a better time to be healthy. Many people with diabetes and many people with other diseases have become extremely healthy this year. So I think it's a great year to kind of really get into some good new ways of cooking, eating, exercising, and some good healthy habits. Sometimes the job can be frustrating. Obviously with long-term conditions, patients often don't feel unwell. People with diabetes often come for their annual screenings and they feel perfectly fine, and their numbers and their blood tests and things may mean that they're heading for some problems in the future. So through education, we can explain to them some of the things that could happen if they don't come for routine monitoring, and it can get a little bit frustrating for patients that obviously may not understand what you're trying to explain to them. So we have to find ways of educating and showing them different educational ways to prove to them that they do need to keep up with their annual screenings. Yeah, so sometimes we have patients that are challenged to kind of accept diabetes and make some changes, but then on the other hand we have people with diabetes that really want to know everything about the disease and make positive changes. We had a patient that we introduced to Park Run in Leamington Spa, and he lost a significant amount of weight and in turn brought his hemoglobin A1C level down and his blood pressure, and I think his mental health also was extremely improved through exercise and a healthy lifestyle, and he does promote it to other people with diabetes in different educational type platforms that we have. I think when you see the results of changes in diet and exercise, and you see how patients with diabetes feel once they've made changes, and once they see their numbers, their hemoglobin A1C come down, their blood pressure come down, they feel better, they feel more positive. I think it just encourages you to try and share that information with others because it's possible. When you meet patients for the first time that have had a new diagnosis of diabetes, it can be a little bit daunting. I think sometimes people think of diabetes and they think of insulin and needles and kind of think we're in such a preventative mode now with pre-diabetes and diabetes type 2 and things that patients is just absolutely controlled with diet and exercise. I think if you explain to patients and educate them that just simple diet and exercise can help keep things at bay, that it might not be so daunting. I think having a team of professionals like the diabetes nurse specialists, and we have a GP specialist for diabetes working together as a team. We can, even for our patients that have very high levels of hemoglobin A1C, we can manage them very effectively. So I've been a nurse for about 30 years, seen lots of change over that time. I think some of the things that are happening in diabetes at the moment are very exciting. As regards to managing patients or helping people with diabetes manage themselves, just through education, diet, exercise, prevention of disease. Primary care is mostly about prevention. We are trying to prevent things from getting to secondary level care, and I think that's really a great big challenge, and again it's quite an exciting time to be in primary care to meet those challenges.